Have you ever mistaken a group of talented individuals for a true team? In this episode, our guest expert shares the three foundational skills that determine whether teams thrive or fall apart, why communication is a performance skill, not a soft skill, and how perfectionism reshapes team dynamics more than you realize. So listen in. Welcome to Success Reimagined. I am Dr. Amna Shabbir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well being. I am so glad you've joined me. Let's reimagine what's possible together. Today's guest is Dr. Tina Patel Gunaldo, an architect of high performing interprofessional teams and a nationally recognized leader in collaborative healthcare education and practice. She's known for turning the science of teamwork into daily habit and for building systems where clinicians, educators, and communities truly work better together. Dr. Gunaldo has founded Collaborate for Health, led Louisiana's first interprofessional consortium, and co presides over the American Interprofessional Health Collaborative. She brings a bold vision to how we train, lead, and connect across disciplines to improve patient care and organizational excellence. Welcome to the show, Tina.
Thank you for having me, Amna. I appreciate it.
I have been waiting for this conversation because I really want to learn a lot today, and I know that our audience will truly benefit. So, what initially drew you into your work into interprofessional education and collaborative practice?
Yeah, I love telling this story. So if you just can give me a minute and bear with me. So I was in academic, I was in education. I think that's the best way to say it, an academic health sciences center. And I was introduced to this concept of interprofessional education, which I had never heard about through now one of my best friends. And so the introduction formally came out of the School of Dentistry because it was a standard for education at that time, and then developed into a committee and then a full office. But in between that journey was the development of a friendship. And one of my I'm going to say this just over and over again because I have to say it. She is a dear friend. She allowed me to join her and her husband's journey through his lived experience in regards to his health care and his medical condition. If she would have not allowed me, and I said, or invited me, I think sometimes I can be pushy, but if she wouldn't have allowed me to join them in that journey, I'm not sure that I would have embraced interprofessional education and collaborative practice in the way I do today. So I'm very appreciative of the lived experience and the lived years that I had helping my friend, supporting her and her husband through their journey together.
It truly is something remarkable when you get to witness something firsthand. And then when you're witnessing it unfold firsthand, there's that passion I feel like that might have just started or a little ember that sparked this fire.
There's so that was it for me. I can tell you that in my life, I've been blessed overall. And of course, I've lost loved ones to aging, but I have not had the opportunity to have that lived experience where you see someone progress through a medical condition that eventually ends up in end of life. And so that spark was important to me. And I'm just going to pull this in, go ahead in terms of perfectionism, because that is your area of expertise. That is actually where I started to learn that healthcare is not perfect. And I know you're in healthcare, I'm in healthcare in a different area, but healthcare was not perfect for this journey. There were lots of errors included in that journey, and there were a lot of supportive opportunities in that journey as well. And I think that was eye opening to me. That was when I was, I say, quite younger without a lot of lived experiences, but it is helpful to know that as we go through our own life, or we go through our lives, not just personally, but professionally as a healthcare professional or a healthcare provider, that it's hard for things to be perfect, especially when you're working in such a dynamic space. So I'll kind of stop there, but I just wanted to plug that in because I think you and I had this conversation earlier. Is like, where is the fit between perfectionism in interprofessional teams. And I've thought a lot about that and reflected a lot about that. And there isn't connection and there is alignment. We just have to talk about it.
I really appreciate that you brought it directly there because I agree with you. I think it is hugely validating when we can take a deep breath and talk about these things openly instead of brushing them under the rug. Oh, no, no, things have to be perfect. Like the system has to flow like that. As if by saying that or writing SOPs and putting them away somewhere or making people go through mandatory modules are going to automatically then somehow plug them into our brains. Our lives are playing out in the most human ways possible. So it's really critical to bring those elements in. I want to jump to our next question now and ask you, what do you wish, now with all your vast experience, that leaders and teams understood better about interprofessional collaboration and how it impacts patient care and just organizational functioning at large? I feel that we get a lot of time confused between terminology, what is the appropriate terminology, and I absolutely believe that words carry value as well as weight, and then share a little bit. This is your opportunity to just talk to everyone.
Yeah. So, okay. So lots of questions, and let me really organize my thoughts. So, one of the things in regards to interprofessional, just that term, you're right. What does it exactly mean? Because I say many of us, but just think back in from the 1970s to the 80s to the 90s, in terms of our training as health professionals, we probably heard of the terms multidisciplinary, interdisciplinary, transdisciplinary. And then all of a sudden in the US, around 2010, 2011-ish, that time, is when this term interprofessional started to bloom. And I say in the US because those in the UK and those in Canada had this term interprofessional education prior to the US. So when we think of interprofessional teams, and I agree with you 100% that words matter and understanding what we're talking about and our intentions really matter. And so when you're thinking about multidisciplinary teams, you're thinking about myself as a physical therapist, sorry, you, Amna, as a physician, and a patient comes to see both of us independently. You and I could collaborate if we wanted to, but basically we go down our own paths. And so I might be seeing the patient for some type of ambulation or gait imbalance, and you might be just seeing them for other like polypharmacy or maybe unsteady balance as well. Just say it's the same condition. But we don't really have a conversation. We just treat that patient in our own silos, in our own lanes. Interdisciplinary means that you and I are going to talk more in regards to this patient and their diagnosis. But what we don't always do is we don't always include the patient as the leader of the team. So important to include the patient and the family and the caregivers as leaders of their team, empowering them to make the health decisions that are best for them. So you go from working in parallel to then talking with one another, not absolutely forming that maybe unified goal for that patient for that period of time. And then you come into interprofessional where when you're talking about interprofessional, you no longer have to say patient-centered care or family-centered care. It's inherent in the conversation. And interprofessional practice is so much more, but I'm just going to kind of keep it short. There are four major competencies: communication, roles, teamwork, and values and ethics. And so we actually have something tangible by which to train behaviors to and to provide knowledge about. So that's interprofessional teams in a nutshell in a short period of time. But why I think it probably does not get the recognition that it does is because when you think about communication as a key, right, component to any type of relationship, you think of it as a soft skill. But I think you know as well as I know that communication is one of the hardest skills to learn, right? And to train for. So many times I believe people think, oh, yeah, let's work together. It sounds really great. We have a great geriatric team. We have a great cardiovascular team. But do we really have a team or are we just a bunch of people making a group? So I'll stop there. But that's kind of in the nutshell interprofessional education, interprofessional collaborative practice, and some differentiating some terms.
That was really helpful. And I was laughing at the end because I can completely relate to, yeah, it's a bunch of people together, and then we're talking about, we're going to make this work. Whereas we never usually have these folks go through formal training on how to show up and be present in that space so that it flows smoothly, so it's more helpful. And I always cringe when we use the word soft skills. So it is always used, in my opinion, in the wrong spaces as life has evolved. Communication, absolutely. It is a critical, crucial skill. So is confidence building. And we think like all of this is fluff, and it's not fluff. I was also told that, well, you should save your patient care reviews because they really can be helpful to demonstrate all these soft skills that you had, and just like brushing them under the rug, which is it's actually a great idea to save the patient reviews because they do reflect on the care that you're giving. Coming back to our teams over here. So now we have a bunch of people, and we'll all put them together. Now, what do you wish that our leaders would do differently, and how just all of us we would just look at this setup through your eyes?
Oh gosh, it was funny because I was asked that the other day about primary care. What did I wish primary care looked like? And I said, I wish it was like this patient centered, I know I said it again, but patient centered medical home where all in one space, we would have an optometrist, we would have a dentist, we would have a physical therapist, we'd have a mental health therapist, we'd have a physician, a nurse, everyone in one physical space so they would be allowed to collaborate in this single space. You don't always need it for interprofessional collaboration, but what I wish really a lot of individuals knew is leaders of healthcare systems, but I think at this point it's just a lot of leaders, is that no one has really trained us. I mean, think about it from grade school, how to work in teams. And I'm going to connect this back to perfectionism because I recently listened to your TED talk and thinking about perfectionism and the three different types and the expectation we set for ourselves, the expectation we set for others, and then the expectation that others set for us, or maybe our perception of what they expect from us. I believe the more immersed you are in your team and the more associated you are with your team, there's that I'd say there's not as much pressure to be perfect because you really are observing the dynamics around you. You really are listening to others around you and understanding what they're saying. You are have an open mind in terms of respect of what they are saying, and you're not trying to anticipate what they're saying. And many times through social media, as you had explained, we're anticipating what that life is on the other side of the camera. We don't know what it is, but we surely are judging, right? What that is. And so I think the more we can be supportive of interprofessional teams, giving individuals time to develop their team together synchronously, asynchronously, there's so many different types of modes, but I believe that it's important for us to do that. And I think if we do that and we increase that socialization, there may not be such a pressure, right, from those who do have this sense of perfectionism because it's real. They may not have as much pressure and put that much pressure upon themselves because they'll realize that they're not alone.
I loved your initial vision for the primary care clinic that you mentioned. Having practiced primary care, that would have been lovely. I was always wanting more amazing colleagues to be there and fully support and be able to provide the care our patients deserve. And I love that you drew in that parallel from the talk, which, if the folks listening have not, please go ahead and watch the talk. It's titled Perfectionism Has a Solution. It's Not What You Think. You'll find it linked into the show notes. I love that you referenced it because perfectionism really doesn't leave room for failure. It also doesn't leave room for collaboration because there's so much shame surrounding anything that we do. Like, if I am supposed to walk into a space and I'm already mind reading, that's what's happening. I am mind reading, like, this is what everyone thinks of me, this is what they expect of me. And then imagine we're all doing this. That just sets up this odd dynamic. So I so appreciate that you brought that in. Absolutely. Is there anything else you would like to add to that?
I think there's so many little stories. I love to tell little stories, and so I'm going to take a tangent right now, and I am going to say I'm going to bring it back to not just interprofessional teams, but I think this is why it's so important to engage with one another through social media. Because here we are talking about social media, and then we're saying, be careful because you might be biased towards what the expectation should be. But I would like to say to everyone here, I think the importance of engagement also through social media. And when you think about interprofessional teams and us having a shared goal, you have a shared goal of educating more individuals about this topic of perfectionism. And for me, when it caught my eye in the conversations that you were having, and as a physician, I have a son who's in medical school, and I can see how, as an individual has put their sights on medicine as being a career, that happens sometimes earlier in life than later. And in this case, it happens earlier. And I believe might be the tendency of some of those learners to set this expectation for themselves that things have to be perfect. They have to make the perfect grades. They have to have the perfect resume building opportunities. They have to go to that perfect school, take those perfect courses with those perfect instructors, and then get the perfect score on this standardized test. And that's not the only standardized test. There's multiple. And what I appreciate in regards to you talking about the subjects. So I'm going to flip this back on the conversations that you have on LinkedIn and the importance of sharing information on perfectionism and how does it relate to myself. And so my son is in his second year of medical school now, but a lot of these learners decide that they want to go into medicine early on in life. And from the time they decide that and what they perceive as medicine, as they see on TV, as they see through social media, as they might even see through their own interactions with their pediatrician or their physician, they set expectations up for themselves. And a lot of those are getting the perfect grades, getting the perfect final exam score, getting into the perfect school, having the perfect resume, and then taking those standardized tests, which also looking for that perfect score. And when you get into medical school, it really continues in regards to getting the perfect grades, getting on the perfect research team. And when I say perfect, it is in the eyes of the beholder of what perfectionism is and they are and what they want to achieve, but it's always doing something to make sure you're setting yourself up perfectly to even then get into that residency slot that you want. And so if you think about someone that wants to achieve to become or wants to become a physician in life, if they set their standards when they're in sixth grade, seventh grade, right? And then it extends all the way up until at least 24 or 25. I mean, you're looking at over 10 years of someone setting up these expectations and standards. And then how do you honestly let it go? So let me bring that back around and say, I am so thankful that I found you on LinkedIn and you're talking about the subject because it has allowed me to have the courage. And I say courage, I am a mom, but I still need courage to have these conversations with my son to let him know that things always won't be perfect. And I can see him and he's going to go down his own path, but I could be his mom just chirping in his ear every now and then, letting him know that I'm learning something new. And I just want to share that love with him and that information and that knowledge. So I want to say thank you to you for bringing this topic forward of perfectionism.
I have goosebumps right now, and I'm just trying to take it all in. Thank you so much for sharing that. And you talk about these things, you do this work, it's creative work, it's reflection, and then you put it out there and you wonder, is anyone listening? Is anyone reading? But my goal is always to just reach one human, and I had to really sort of get over myself. I was really shy talking about this. I was shy writing. I'm a physician, I'm risk averse, and putting yourself out there sounds really risky, and the fact that you were listening and it resonated and, you were reading, it just means a lot to me. Thank you so much for sharing that.
You're welcome. And I'm just going to say that turns into interprofessional teams because if I wasn't trained interprofessionally to learn how to actively listen, to learn how what I might learn from someone else as whoever's on my interprofessional team, it doesn't have to be necessarily professions in this case. It's you, me, right, and my son. That's our team. But it's taking knowledge that I've learned from someone else like you and understanding what that is because I've actively listened, and then understanding that there's someone else on my team. They don't have to tell me that they need this information, but I know by the way they act, by the way they speak, by the way they react, they need this information. And so, not asking that person to sit down and follow you on LinkedIn, not that my son wouldn't do that, but I'm not forcing any prescriptive, I guess, actions out of it, but I'm willingly sharing that information. And that's called implicit coordination. So if we talk about the team science about interprofessional teams, this is a perfect example of how it works. It's sharing knowledge, it's anticipating someone's needs, giving yourself fully to that team because you care about the overall health of everyone. And it's not an individual path. Anyway, I had to bring that around too, but I think that's a great example of how what you talk about and what I talk about really is just something that aligns very well. And I would encourage those who feel like they have these thoughts of perfectionism to think about the teams that they're on and how might they create an environment on those teams to where they feel that they are included more, that they belong more. What can they do? But what could the team do for them? Because remember, it's a bi-directional relationship. It's not just about what can I do for the team, right? That's perfectionism maybe coming out, but it's what can the team do for me?
Implicit coordination? That
Yes.
was such a wonderful golden nugget that you shared there. And I really love that call to action to just like slow down and pause and observe where perfectionism is showing up in your teamwork. So thank you for sharing that, Tina. We
Yeah.
talked a lot about the good stuff, right? The how can you make the teams work better? Now I want to go
Mhm.
to some disaster scenarios. So as someone who's an expert on high performing interprofessional teams, what are some of the settings that you have seen just lead to absolute disasters? And so we can reflect, or if people are headed towards a disaster, they can see, or sometimes people are in disaster situations, but they're all just like clinging and not ready to let go.
I mean, that's a great question. So I'm going to just push back a little bit on that question because the way I think about interprofessional teams is really a lot like primary care.
Hmm.
So, what can we provide in terms of supports to prevent the chaos or to prevent the struggle that teams mostly have? And when I think about any team, and I'm not going to say any because it's not all, but when I think of many teams in healthcare these days, and at least what you hear a lot on the news or in blogs or from other friends and colleagues, is the fast pace, right, of healthcare today, the dynamic piece. And if you think about it, every time a patient walks in through that office door or a client, depending on who you are in terms of a health professional, that's a new team. So everyone else might be static, but the person who matters the most creates a new team. That enough is hard to deal with. So what I say is then how can we create structures around the rest of the team that's going to help support them no matter what that unique patient brings to the table? And so, if we can allow our healthcare professionals to do what they love to do, which is to care for others and how they were trained, and we can set up systems and structures and processes to support them, right? Not to slow them down, not to hinder them, not to put 10 band aids on a CMS or a Joint Commission accreditation standard, but to actually allow them to care. You will prevent a lot of the chaos that exists. Does that take time to do? Absolutely. And so you can't negate that saying, oh, we're going to come in the next day and we're just going to start doing these morning huddles. Well, what does that mean? Where do we have time for morning huddles? Who's going to prepare for those morning huddles? And so the more and more now that I see healthcare in action, and I say that because I spent 10 years of my career first in practice, then the next 18 years in an academic health sciences center. And I just re entered practice again about a year ago. So the more I observe this past year, what I've seen is that We just don't have the systems. I'm going to say it again, the systems and the structures for managers, for administrators to help support the team. And when you think about healthcare as well, everything is set up in silos. You have a rehab department, you have a respiratory therapy department, you have nursing units. But on nursing units, the whole team comes together to see patients. And so, why are they called nursing units? It's much broader than that. I'll stop there. But this is kind of this conversation of interprofessional teams of what I love and why I say I'm an architect of high performing interprofessional teams, because it's understanding all of those components and really understanding the training, the professional culture of everyone that's on that team, because they do bring something different and unique to the table.
And if we did all of that, we would also take care of a lot of moral injury that all health professionals go through on various levels. Instead of blaming, we are understanding. And when we understand, and as with someone of your caliber and training, if you understand the nuance and set up the system in a way that it can actually flow, then we can avoid all those disastrous situations. So I love the reframe. Tina, how have you reimagined success for yourself? You're a leader, you are a high achiever, and you are the mom of high achievers. So at this phase of life, as we look at the passing of seasons, the beginnings of new times. I read your posts and I always get inspired. You make these dynamic polls on LinkedIn. I just see so much change and transformation in just like the messages you share. How have you reimagined success for yourself?
So this is funny because as when I started to learn about you and listening to what you provide in LinkedIn, I started just to reevaluate my life and my journey. And I think if you were to ask my family and friends, you might even ask them today, and they might agree with you that I have perfectionism. But I would say on the spectrum, maybe, because everything is a spectrum, right? Is that I've learned that I I can't have these high standards, because if I have these high standards for myself and others, I'll never be happy, because I'll never be able to find pleasure out of those pleasant surprises. And I say that today because I have the opportunity to be home instead of at work right now. And I was looking outside of the window earlier and I saw a little bird, and I watched and I was like, that's really sweet. And then I just kept watching this bird for the next 5 minutes or so, going from the ground up to the top of the gate, into the tree. And that's a pleasant surprise. And if to me, I have to enjoy those moments, right? It's not just seeing it and going, oh, that's great, but to kind of watch that entire, as long as the bird was willing to stay in front of my view, to be able to watch it. And so, what I say in terms of being a leader and understanding perfectionism is that it is a journey. And that for those of us that do have these high standards, recognize that everyone doesn't hold as those same high standards, and they may never want to achieve those same high standards, but they bring something else unique to the table. And I'm just going to say that overall, allow I say allow. This is so funny. I try not to tell people what to do, but I provide them knowledge or maybe a story or an experience and ask them what do they think about it. And so I think in terms of leading and in terms of development, I say to everyone, give yourself time and give yourself grace, because it's your journey. You have to figure out how you want to pave the way for that journey, and it does change. It changes from when you're young and you're striving to be this professional, to then you get married and you're joining two families, and then maybe you create, and this has been my journey, you create that family of your own, and then you transition from one setting to another setting, back to another. You change locations of your home from different cities, and all of this is happening, right? And so it's really hard to expect everyone to be on the same page of you, I guess, in terms of wanting what you want. But what you can do is provide knowledge and maybe awareness and experience, and hope that if not at the point of time of delivering that information, that maybe later they reflect upon it and they think about it. So It's really a combination of lots of things. Gosh, I could keep going on and on, but I'm going to stop there. But it's definitely a journey. And I know that there's leaders in every single one of us.
Thank you, Tina. This was remarkable. What I heard from your reflections was this recognition that, well, we have to recognize when good enough is good enough, as well as recognizing that we are in a dynamic state. One of my earlier guests, Tanya, on the podcast said perfectionism is static. And I really appreciated that. As you explained about the bird, and you just practicing mindfulness and being aware of all of that and adding those components of awareness, of being grounded, and recognizing that life is more a state of being than getting somewhere or setting this arbitrary goal in our head and beating ourselves up till we actually get there, which is what most of my life has looked like until up recently, where I have just done a lot of work surrounding this. It is still a very ongoing process, I say. So this was incredible. Thank you for sharing your insights with our audience. How can we learn more about your amazing work, educate ourselves, and connect with you?
There's one way to get in touch with me, and so I would say it's linking in on LinkedIn and giving me a follow or connect, and I say this to everyone all the time. Feel free to just message me if you have an instance where you think something's not going on with your team and you just want some advice, all you have to do is message me and I'll get back to you. The other place, which is maybe not as easy as LinkedIn if we're all on social media, is that I do have my own website, collaborateforhealth.com.
Wonderful. And I can vouch for Tina's incredible posts on LinkedIn. I always learn something from them. I already shared they're pretty dynamic. You'll get a lot of interesting polls. And you do make everyone feel like I can create happy teams. And here's how to do that. Happy teams. Thank you, Tina.
You're welcome. Thank you for having me.
You might believe you don't have the time or energy to focus on yourself, but this is exactly the right time to get serious about your well-being. You don't have to do it all alone. I'm here to help. If you enjoyed this video and are ready to take the next step, head over to dramnashabir.com where you'll find free resources you can access right away. The website link is below. Let's get started on your path to thriving.